Hello and welcome back, and today we will be discussing yet another case of Asian blepharoplasty or the crease creation surgery. So in this surgery we create a crease in the friends who do not have a upper lid crease, especially done for the patients who or the clients who are from the northeastern part of our country who congenitally they have an absent crease. So they want a crease, and it's a very simple surgery which is done under local anesthesia, and I'll be showing you through a patient who came all the way from Arunachal to get her crease creation surgery done with us. So friends, as you can see in the before pictures, this girl is very pretty, but she desired to have this upper lid crease and she wanted it at a moderate level. She did not want it very high or very low, and we planned her crease at about 8 millimeters from the lid margin. Usually we prefer to keep the crease level from 6 to 8 millimeters. For those who desire very high crease, we can go up to 10 millimeters, but that is very rare. Ideally I prefer to keep it somewhere around 8 millimeters. So this is the marking, as you can see on table after she is lying down with her eyes closed. This is the area where I have marked the crease, and this is the level of the crease I would want to create in her case. We have discussed everything with the patient. I prefer to discuss it before surgery. I try to put a clip just to show her that where the crease would lie after the surgery. Since she is very young, we do not need to remove a lot of skin in her eyes. Those who are older, those who have excess skin, we can remove a lot of extra skin also, but in her case we only needed to create a crease. So this is the cut we would give, and this is after the surgery. Immediately after surgery I prefer to create a crease, plus I prefer to remove a little bit of fat and a little bit of muscle so that there is a more natural attachment between your levator muscle, the muscle which lifts your eyes, and your skin of the upper lid. We create this crease, we make an artificial attachment between your muscles and the skin, and this is the picture at about 10 days after the surgery. So usually I recommend you to get your stitches removed at about 7 days. There are options of putting the dissolvable stitches, but particularly in Asian lid surgery I do not prefer to put these dissolvable stitches because I would want a much stronger stitch to be there for about 7 days and then remove it later so that there is no additional mark or the hatch marks around your lid crease. Initially the crease level would not be exactly as your cut. It might be a little bit above or below. It is all because of the swelling in the upper lid. The swelling is because we have cut the skin all the way from your inner portion to the outer portion of your eye. So since I have cut everything from here to here, the blood supply of the portion which is below will be a little bit hampered, and the blood which is going back will take some time, and it takes almost 8 to 10 weeks for this blood supply to re-establish. So the swelling completely goes down in about 8 weeks. You are socially presentable in about 10 days to 14 days, but the final result would be, I would say, around 8 weeks. The lid position would be there at about 8 weeks. Initially you might feel that the lid position is very high. It is because the swelling in the lower portion is much more. So later on the scar would be visible. You are allowed to put makeup and everything. After about 10 days of your surgery, you are allowed to use any kind of makeup to conceal your scar. This scar usually takes about 3 months to 6 months to get a little bit less. You can always massage this scar after about 3 weeks of your surgery to make the scar less and less visible. There are multiple creams which are available, multiple ointments available in market which could be used to make the scar less visible. Overall, it usually takes about 6 months for the scar to become very less appreciable or very less visible. So this is about the whole journey of the upper lid crease creation. In case you or any of your friends are interested, you can always visit us. We regularly make contents on blepharoplasty. I specialize in blepharoplasty, be it the lower, the upper, or anything around the eyes. If you have any of such concerns, you can always contact our team on 9599554211 and we'll be happy to help you. Thank you and have a nice day.